Using paper and fax, the average number of interactions, there's 17 episodes back and forth. Yeah, so we often like to say that, our biggest competition is just market inertia. Hospitals are essentially begging for this, right? Leadership teams and saying, hey, we're done with the fax machine. We're getting inundated by DME companies. Creating a digitized experience on this resupply, I firmly believe, is the next frontier in the DME space.
This is a conversation series about the people shaping the future of healthcare. These are the leaders who see opportunity where others see obstacles. Each episode highlights experts that understand the complexity of healthcare but choose to act with clarity, purpose, and optimism. We call ourselves co-conspirators because we aren't sitting around waiting for change. We are driving it. Welcome to the Co-Conspirator Track.
Darren, thanks for coming on. But before we really jump into the meat, I'd like to ask you just to give us a background of DMEscripts and you and really your role there.
Yeah, sounds good. And Caleb, I really appreciate the opportunity to join your show and look forward to our conversation. So DMEscripts is an open network connecting many providers to many suppliers. We're a DME-backed utility per se, backed by the DME industry. So if you look at our cap table, many of the large national companies, as well as some semi-regionals and even some mom and pops, have invested in us. So we were born through the lens of industry efficiency, right? So a lot of old habits and antiquated ways to prescribe DME. So we're that last mile connectivity and e-prescribing for a wide array of DME products that doctors are prescribing. My role at DMEscripts is Chief Revenue Officer. So in my role, I oversee our hospital system relationships, as well as a new strategy that we have with a de facto sales force called Physician Liaison. So I'm managing our go-to-market strategy and the trench warfare, as we like to call it, in the DME space, so we can have more control over our messaging to the prescribers out in the marketplace.
Yeah, so tell me a little bit about what's right in the face of your customers that you guys are in the trenches tackling.
Yeah, so there's been some independent analysis that's been done on this antiquated way of prescribing DME that I alluded to earlier, Caleb. And this analysis came back and said, using paper and fax, the average number of interactions, there's 17 episodes back and forth between the entity that's prescribing the DME and the DME company on the back end that's servicing that patient. So as you can imagine, that administrative burden ultimately leads to poor patient outcomes, right? Because whether it's delay of discharge, or oftentimes patient doesn't even receive their setup, right? Or their equipment in the home. And so what e-prescribing does, and specifically DMEscripts, is not only can we get that order accurate and fillable and billable 94% of the time at first swipe, but from a provider point of view, it shows exactly where we're at in the lifespan of that order, right? Because oftentimes what happens when that patient gets home and they don't receive their equipment, that first phone call is going to their doctor's office or their hospital asking, where's my piece of equipment? Or they're calling their DME company that they've been established with. And so oftentimes it's the patients that's stuck holding the bag, right? And trying to control their own destiny. And so there's many efficiencies that are gained by, just having true visibility to where the order is, but then ultimately sparing the provider and the DME supplier the back and forth, and creating a much more efficient and overall better patient experience whenever it comes to delivering DME.
Do you feel like your solution has evolved? Do you feel like you guys have had to adapt or change?
Yeah, so we often like to say that, our biggest competition is just market inertia with respect to old habits dying hard. But absolutely, we've needed to change and adapt, because what's crucial in the DME industry are not only the new orders that are coming over, but really it's what we talk about as ongoing patient maintenance. Literally the millions of patients that have been established on service, across a myriad of product lines, whether it's sleep, whether it's CGM and diabetes and wound care, et cetera. So even oxygen, right? So those require ongoing refill recertifications, right? There's varying degrees of complexity whenever it comes to payer disparity and what each payer requires, whether it's a prescription, so it's this ongoing resupply that I think is mission critical for e-prescribing to deliver a better all over overall experience for the provider, right? So what we're aiming to do, and we're hyper focused on the user experience when it comes to not only prescribing DME, but what I would say is the, taking care of those patients after they've been on service, because there's many more episodes that are involved. It's not just you send a prescription over one time for a CPAP patient. I mean, they're getting their resupply every 90 days. Their payer might require an updated prescription, every 12 months, so on and so forth. And so I think it's mission critical that as an e-prescribing company that we adapt our workflows and think strategically about other companies to align with that specialize in really creating an overall better experience for the provider, which ultimately is going to, that adoption is going to lead to better patient outcomes, compliance rates being higher, which ultimately reduces the cost of care in the whole pantheon of healthcare spend because patients are actually using their equipment. And that's ultimately what our goal is, keeping these patients out of the hospital and driving down the cost of care.
If you had to pick one workflow you'd want to reimagine, mission critical one that you see is struggling the most and the one that's causing the most pain for our patients, what would that workflow be? What would you fix if you could just snap your fingers and fix it?
Absolutely. It's this resupply component, Caleb. I mean, it is, as you can imagine, whether you're a small mom and pop pharmacy in Texas, or if you're a large national, you're taking care of a lot of patients that are on service, right? And so oftentimes that's a manual process and the data can be old, right? We know patients bounce back and forth between payers, and with the the fluidity of payer guidelines changing frequently, that whole manual process combined with bopping back and forth between different payers and these guidelines changing, the workflow absolutely can be improved. And creating a digitized experience on this resupply, I firmly believe, is the next frontier in the DME space. There's literally millions of dollars that are spent by DME companies just to take care of and get paid for the patients that they're already taking care of and that they've already set up. So if we can address that problem, right, to your point, like what is marketing? They try to identify the problem, and that problem is truly on a grand scale what we're aiming to solve at DMEscripts, and we're excited to take on that challenge and truly believe that we're going to have a go-to-market strategy that will help prove the efficiencies that we're capable of.
Totally agree with that. I mean, that's just a problem that we've seen as well. And really, I think the segue into that is the AI space, right? It's cliche to say that everybody's talking about it now. It's the new buzzword, right? That's everybody says that over and over and over again, but it's not, it's just a part of what we do. I use an LLM every single day, frequently all day. And so I use AI for voiceovers now to generate images, and it's becoming part of my workflow. Right. So how are you guys leveraging AI?
I believe AI, especially going back to what I spoke about with respect to this resupply, fulfillment component, is prior authorization, right? So prior authorization can be a complete albatross for these companies getting paid for what they do. So if we can leverage AI and the learning engines that have well established, the learnings that come in from the millions of faxes, leverage AI to tackle the prior authorization component of DME, it would be a true game changer. So I think the automation that could come with, going to fetch a chart note, let's say for a CPAP patient, right? So you got to go find the sleep study and the qualifying documentation to ensure that patient can continue on CPAP therapy and get their resupply. And having that payer logic built in as well would be another game changer. So, partnering with QHINs to get real-time information, the patient's insurance and what the qualification criteria may be for that given insurance. So I really see AI being a powerful engine in tackling the ongoing RCM issues and that I've already spoken about in the DME space. And so that's where I really see leveraging AI to be a game changer. And, DMEscripts, we're very committed to sticking to our knitting, right? So we're an e-prescribe company, and we think strategically about who to align with and who to best align with to come up with a go-to-market strategy, realizing that, we're, as a platform, we need to come up with value adds for our customers to improve the overall experience. And we're hell-bent on that. But we do believe that it's best accomplished by strategic partnerships with, companies like Valir, where you guys in your swim lane and mastering, what you guys have done from a tech perspective, we firmly believe that we're better together as opposed to, trying to conquer the world and have all these value adds within our own platform. So we want to stick to our knitting of being an e-prescribing company and that last mile connectivity, connecting many prescribers with many DME suppliers. And we think, leveraging AI is a component of that, but by doing that with strategic partnerships as opposed to our own biz or tech development.
We take a similar approach with Valir, with working with you guys, and even notable as our LLM or as our AI component. And I think there's this, dogma about, we have to build an AI. We have to build our own AI. We have to create our own, train our own model. And I really don't believe that's the case. There's enough really fantastic players out there, even just competitively too, of like, you have options, right? It's not just one person doing one thing. And so I love your perspective there. Right? We definitely share that. And so can I unpack that a little bit more on interoperability, maybe the connectivity side of that? It is, yes, we want to partner, but it is tough sometimes to create partnerships because of a lack of connectivity, because of a lack of, or the cost it is to link, to create, connection with partners and stuff like that. So how are you guys approaching that? How are you tackling that problem in the space right now?
So DMEscripts, with us being an open network, right, and backed by the DME industry, it's in our core fabric of our culture that we're based upon industry trust, right? So we take industry trust to heart, and you see that in various aspects of our business, right? Us being an open network, not necessarily showing any, we're not showing any favoritism to our network, and there's no steerage with our platform. So first and foremost, it's based upon trust and relationships, right? So we want to make sure with that trust, we have, pricing transparency is mission critical too, right? So we're very upfront about our transaction fees, et cetera. And I mentioned that trust aspect, Caleb, because that's exactly the same approach that we're taking from a partnership perspective is aligning with companies that we feel espouse the same value, right? With, not necessarily being behind cloak and dagger. It's more partnerships that make sense for us to where we could stick to our knitting, partner accordingly with subject matter experts that have developed the tech, like to your point about a notable, right? The machine learnings that they have, and not necessarily recreating the wheel, and having those partnerships and creating really a go-to-market strategy that we believe could be a game changer when it comes to, all encompassing, right? Whether it's a brand new order, right, which DMEscripts can tackle, but really this resupply component that I continue to hammer home on, but really taking the guesswork out of that and making it a seamless experience for the customer. Ultimately, I would say, how are we approaching this? And it's really one based upon making sure that people understand from a partnership perspective that DMEscripts is absolutely the right partner because of our open network and our standing as being a DME industry asset.
And as you do expand, as you do bring on more customers, and you talked a little bit about your go-to-market strategy there and the openness and really, you guys are agnostic, which I think is, very, very powerful in our industry right now. It is struggling on that side of things of closed networks and closed, ecosystems, and you get locked in depending on your ERP and stuff like that. And so the more openness that can be facilitated in the industry, it's going to make things, I think, better for everybody, right, at the end of the day. So, that's our mission at Valir. I know you guys share that. And so I think that's a really powerful perspective. As you expand, are you having to shift your go-to-market strategy? Are you having to change the way you talk to customers? Has AI and really there's been a lot of different intake solutions, a lot of different e-prescribing, everybody does something some way, maybe
Right.
not exactly the same way somebody else does it. And so how are you guys approaching that? And have you had to shift at all?
Yeah, I think we definitely, and you've seen this with our go-to-market strategy with health systems and in particular, right? So we're shifting the way that we think about e-prescribing in the sense of really trying to lead with that resupply component as opposed to just the brand new like hospital bed order or that brand new oxygen order. Of course, we aim to tackle that market and that opportunity. We just feel like there's a more effective way of doing that, and that's through creating a better overall experience on the resupply component. So yeah, we absolutely have. I in fact I think that's been the most, what I would say, eye-opening experience for me in my tenure at DMEscripts is realizing that there's all these millions of patients that are already on service that require so much ongoing maintenance. That is the way to win and drive adoption. And so I think it's sort of sped up our internal strategy in terms of who we partner with and really putting that on the fast track. Because if we can tackle that, then I feel like that adoption is going to help drive the experience from a provider point of view, where that doctor from a resupply component, if he or she has a good experience with that, then they're more prone to make their new orders through e-prescribing platforms like DMEscripts. And so, I think that we've seen a fundamental shift internally on what we aim to accomplish. And hospitals are essentially begging for this, right? Because they're doing more with less. Their margins are being compressed. So their end users that are placing DME referrals are going back to executive leadership teams and saying, hey, we're done with the fax machine. We're getting inundated by DME companies with oxygen recertifications or, CPAP prescriptions, whatever it may be. And they just don't have the manpower in order to tackle that anymore, which is why we have tremendous opportunity by digitizing the experience. And once we show them the merit of e-prescribing on the refill process and resupply process, it's going to drive behavior for new orders and ultimately drive what we believe is going to be transformational for the industry, right? I mean, there's still a lot of blue sky, Caleb, whenever it comes to adopting e-prescribe. And so, what we continue to hear from hospital systems is we're done with the fax machine, and our case management department is just debilitated. And so it's incumbent upon us, right, to be able to message accordingly and be more proactive and aggressive from a sales perspective on selling the merit. It's been, quite frankly, it's been a miss for us at DMEscripts. I mean, our internal team has done an amazing job up until this point, but I think that there's a better way to go to market with a sales force that is leading the charge from a messaging perspective and selling the merit of e-prescribing. And so I definitely, though, I've seen that fundamental shift of taking care of these patients that are already established on service and leveraging that aspect to drive more e-prescribing on new orders.
You guys just recently secured a big investment, right?
Yeah, Navant Health out of North Carolina.
Has this reshaped, you guys' growth roadmap, or has it unlocked anything that you felt like wasn't really possible until this moment? Or I guess, has it just accelerated what you guys are doing?
Yeah, all of the above, right? It's been transformational for us. Invest in our executive leadership team, improve our tech, right? So we're in the process of looking at, ramping up our platform and making that more up to date, but then also really executing on our strategy, right? So I just alluded to our go-to-market strategy with building out a sales force, right? And so really it's given us and blessed us with the opportunity to execute our strategy. At our inception, being backed by the DME industry, oftentimes the onus was put on those sales teams, right, to go out and sell DMEscripts. But I think that while we're deeply appreciative of those efforts, we want to take that burden off of the DME sales rep and go more on the offensive. And so ultimately, Caleb, like, investment has led to us being able to hire the appropriate folks to deliver on this strategy. But then it's also, created and opened up doors for us at other health systems, right? I mean, it's somebody with the powerful name of Navant, which is a truly innovative and terrific system to work with, has really opened up doors for us on a national scale. And we're really excited about the prospects of further investment from other hospital systems that are in the works, but then really leveraging, the power of our network. So, to be frank, we had, with us being an open network, we had, the DME, suppliers and as a part of our network, but really that void that we were missing were the ones generating the orders, right? The hospital systems that create a majority of the DME orders. And so we aim to rectify that, sort of that flywheel approach, that network approach that we know that we're capable of. And so that void with the healthcare systems and Navant spearheading investment in us is we're really excited about, because it's opening up doors for us nationally and really affording us the opportunity to execute even further on our strategy.
What are you most focused on right now? And is there a special project or initiative that you wake up every morning and you're just pumped about it and you're like, let's go team, let's get this done?
Yeah, that's a great question. And so, I think what really is motivating for us, this whole supplier initiated opportunity on a resupply. And I don't mean to sound like a broken record, Caleb, but it is one that's motivating. Running parallel with that are the conversations we're having with various hospital systems, as well as some payers that really see the merit of our open network and being able to partner with DMEscripts for better outcomes for their beneficiaries. But I would say the various health systems that we're in conversations with, combined with executing our batch resupply technology and the capabilities that we have in the platform, are incredibly motivating. So, I would put those right neck and neck, because these, as I mentioned before, these hospital systems are clamoring for more efficiencies whenever it comes to the DME experience from a provider point of view, right? When placing these orders. And so whenever we're able to offer up a solution that not only for the new orders, but then for their doctors that are inundated with the ongoing paper and fax to keep the patient on service, it's really motivating, right? And we're making a material, a tangible difference in the workflows of health systems. And so whenever you bring a solution to the table that is a solution to a major problem, it's very motivating. And we believe that we're perfectly situated as the next round, as the boomers go more into needing home care, right, to reduce the cost of care, and the need for DME increases. We think that we're incredibly well positioned to be their partner of choice from an e-prescribing perspective at DMEscripts.